This is your report. And I think this will be your report. Mr. Lethole, again, I've shown you, he was not offered food or a meal. There's no word denial, I want to take that out, for 100 hours and 54 minutes. Mr. Lethole also demised without knowing his COVID test. Mr. Lethole's tweet, the one that came out on the 25th at 2031, was just the tip of an iceberg. But what is important is that it was authentic, it was truthful, and really, I think it meant what it said. Tembisa Hospital was really not fit to be what it's and ready for the COVID pandemic. During the course of our investigation, we found that the nurses and the doctors did not work together. There was no team spirit. Between the nurses were not also working together. The doctors between the doctors were not working together. So it was almost just like a zoo of people that are supposed to look after patients. So I think this needs to be investigated by an independent process. And then I make the following further recommendation, that in the light of these wide-ranging findings that I've spoken about, of the food, the medical care, the tests, and the SARS-CoV tests and others, and the clinical records of the hospital, I make a recommendation that really the accounting officer has to be taken to a disciplinary process for really running the state of affairs that is almost as it was. He really sidelined, I think, proper processes. He sent me and Dr. Bandile Masuku the wrong information that he signed for. There were notes that, as I say, of doctors that were missing that he never reported and never alerted us to them. And I think that should have been a courtesy, something at least to say, I'm sending you this, but there are these defectives, and he never did that. So I think on the basis of that and many others that I think when you read the full report, you'll find, I think we believe that he should undergo a disciplinary process by the appropriate processes and not through my offices. We also believe that the Gauteng Department of Health and Tembisa Hospital should undertake disciplinary process against 19 staff members that you can characterize them as medical doctors, people that are in charge of food, and the nursing staff. They are all listed, I think, in my report, and I think it would be useful, I think, when you read the report in the media brief, I think they're all there. 19 staff members have to undergo discipline for whatever they have done.